Good evening, everyone. Am I clearly audible to you? Please let me know. Just give me a thumbs up or write in the chat box. Is my voice clearly audible to you? Can you all write down? Hi, hi. All right. So, yes, I am audible. All right. Great to see you all. Hi, Upasna Sarna, Sarma, Amandeep Kaur. Uh, I hope that I'm pronouncing all names clearly. If not so please excuse me. Bidhu Krishna S. We are Anantha Krishnan, Juri Bhuvan, Nandini Kaushal, Anisha Chaudhary, Namrata Sharma, Ashwini Verma, Aarti Rani, Anita Francis, Rishita Devnath, Veronica, Sagrakavam. Sorry, but Anita Francis. Anita, yes, we can't hear you. If you want to say, then just raise your hand. I'll allow you from this side, and then you can. You will be able to. We will be able to hear you. If anybody wants to say, they can raise their hand. I'll allow you from this side, and then you will be able to. We will be able to listen you. All right. Got it. Wonderful. So welcome you all to Next Gen Academy. I hope that this is your first course from Next Gen Academy. Some of you might have joined for counseling, some of you might have joined for clinical, but it was merged up. So you are you are benefit. All right. Wonderful, wonderful. So I hope this journey will go super excited with lots of fun, with lots of entertainment, and of course, with knowledge and experience. Wonderful. Class has to be interactive. This is the first rule of the class. Class has to be interactive. You don't just have to put on your earphones, join, and just listening. I'll be asking you questions. I'll be asking you examples. The class should be two-way, no lecture based. Wonderful. All right. Is there any questions, any type of questions before I introduce myself to you? Before I introduce our academy, is there any question from your side you want to ask? Yes, Nandini, recordings will be provided to you. Recordings will take almost 24 hours and then it will be available in your app. And you will be given these PDFs also of the slides which we will be showing you in the class. It's okay, Nandini. We will be coming on your part as well that what are you doing? Wonderful, Nandini. All right. Any doubt from any other person? Wow. So it's a good batch, good strength. Wonderful. So many of you have joined right now. Aditi Datta, Dalia, KP, Jaslyn, Josie, Kanam Puzza, Savani, Abhay, Gokhale, Mohit, Aparna Thakuria. Hi, Hi, all of you. I was just welcoming you here in your course. All right. So before starting, I want to introduce you towards Next Gen Academy. It's been a couple of years. It's been in the industry. Apart from psychology, also there are so many courses. So the vision is to provide good education at minimal prices. And coming to myself, so my name is Simran Taseen Hanta. I'll be a psychology faculty throughout the session. Coming to my experience, I've been into this industry for almost 10, 11 years. I have experience as counselor for over 8 years. I am triple masters I have completed. Currently, I'm working as school counselor, as counseling psychologist, and working as a family therapist as well. Again, other peoples have joined, others have joined. Again, I would like to thank you, Jocelyn. Thank you. So, few more participants have joined. So, I would again like to mention this class will be highly interactive. Thank you, Nandini. All right. I would like to mention again and again the class should be interactive. It will be a two-way communication. As this course is very vast and still this science is not so old, this is a debatable topic that psychology is a social science or a science. So it should be two-way, practical based with real life examples and more discussions. All right. So before beginning or before moving ahead, I would like each one of you to introduce yourself. All right. First, mention your name in a single chat. From which state or city are you? Which semester or year you are in? Which course and which university? Five things. All right. If you are working, then what is your highest qualification, your role or your designation, and in which company? Five things. All right. Wonderful, wonderful. I was reading all your chats. You're having wonderful experience and all. Wonderful. Let me read aloud so that you all can be introduced to others as well. All right. So, Savani, I hope it's Savani. I'm pronouncing your name right. She's from Nashik, Maharashtra. Bachelor of Arts. Wonderful. Nandini. Reiki Grandmaster. Oh, great, Nandini. Wonderful. Nice meeting you. Dalia from Kerala in MSc. Wonderful. Clinical counseling, Charan Preet. Great. Hi, Anita. Great. Jury is also in college. BA. Aparna, Assam. Jasmine from Calicut, second year. Veronica, Manipur, fourth semester. Guwahati. Biru from BSc Kerala. Anisha, Rajasthan, third year. BSc. Namrata Sharma, Jaipur, third year. Great. Amandeep Kaur, Punjab, MA Psychology, second year. Great. Rishita Devnath, fourth semester BA from Assam. Aarti, uh, Aarti, MA Psychology. Hmm. Say the chats are moving ahead. Patiala, Aarti, Rani, alright. Upasna, BA fourth sem from Assam. Aditi, fourth semester from Guwahati. Jasthami, fourth semester, Guwahati. Alright. Baswati, second year BA from Guwahati. So many are from Guwahati, Assam. So many of you. I hope that all right. So we are Anand Krishna. Great. Ashwini Dehradun, Prachi, 6th Sem College. Okay. Asta Baruha, BA, third year college. Great. I guess, yes, you all are from same college. You all are. Is there anyone left? Is there anyone left? Is there anyone left? Please mention. Are you left? Is there anyone? So I guess no one is left. Okay. So moving ahead. First, have has anyone gone with the curriculum, the lesson plan, the curriculum design which was sent to you? I hope that was sent to you. either in your WhatsApp group or on the application. It was sent to you. Has anyone gone through the curriculum design? All right, so Pratiksha and Nausheen were left. All right, yes. Great, Savani, great. So you have done your homework before attending the first class, the very first class of yours. Yes. Have you gone with it? So it was merged. It was more into counseling plus clinical and more of the practical side. All right. So we are done with the ice-breaking activity, introducing each and other, knowing so that we can cope up. We can move ahead. We don't feel almost all. Some of you were from the same college, but still, we should know each other. All right. So I introduced your academy, I introduced your faculty, you guys were introduced towards me. Now let's introduce the basic or the first class for which we are over here. So foundations of psychology. Can anybody explain me what do you understand about the foundations of psychology? As we have so many of you are not the fresher. I hope that you were having the psychology subject in your school also. If not, it's okay. If you opted in your college, then also it's okay. But still, you nobody is in the first year. But if I ask, what the first thing comes to you, comes to in your mind, or what do you understand? What are the major foundations of psychology? What do you think of psychology? Foundations basically means the main principles of subject psychology. Great, Savani. What about others? What all others are doing? What about others? Is there any network issue? Is there any network issue? Because the students' number are keep on increasing, keep on decreasing, increasing, decreasing again. Is there any network issue from your side? No. Yes. So the basic, or as Savani said, the foundation of psychology means how the main principle Savni said, no shame saying means how human brain work, how people perceive the world. Yes, it's the definition. Jesslyn saying it shows the concept about human behavior and mental processes. Yes, these all are the lines which are from psychology students. Emergence of different schools of psychology paved the foundations like structuralism. Great, yes. These are the five schools of psychology. Hmm. See, since this course or this internship is focused on counseling and clinical psychology, so it's essential that firstly we should understand the foundational concepts of psychology before moving ahead to specialized topics. That's why it is uh, important to start any of the thing, whether you know it, whether you don't know it, whether you have ample amount of of knowledge, whether you have 50% of knowledge, some amount, but to start with the foundations. Okay. So, yes, the definition, as most of you mentioned, is psychology is the scientific study of behavior and mental processes. Psychology explores how people think, feel, behave, and in different situations. And what do we, how do we name? What is this process called? Thinking, perceiving. Great, Dahlia. Emergence of different. Oh, already mentioned. Do we say it cognition? Also, we have many branches of psychology. Can you name some of the branches of psychology? And I'm mentioning if anybody wants to speak, they can raise their hand. They will be allowed from this side, and then we will be able to listen to you. Or else, keep on typing, keep on typing. And why so typing? Because तभी तो हमें याद रहेगा. By the way, are you all comfortable in English or Hindi or both? Both. In which language are you comfortable? Come on, quickly. There's a poll. Quickly finish it up so that I can understand and then we can move ahead. There's a tie between English and English. Quickly come to the poll section. So the time is over. So majorly it was for both English, English. All right, fine. So we will be doing in the both ways. ठीक है? Again I'm repeating. अगर किसी को बोलना है तो वो hands allow कर सकते हैं. Hands up, ठीक है? And there are many branches of psychology, many branches. Just name few branches of psychology where you think the psychology can work. You must be knowing. Everybody will know. Tell me the branches of psychology. Wonderful, Dahlia. Wonderful, yes. Health, sports, rehabilitation, clinical, applied, industrial, organizational, counseling. Yes, counseling psychology, clinical psychology, cognitive psychology, behavioral psychology, developmental psychology, social psychology. There are so many branches. Okay. So let's do one activity also. Uh, Give some real life situations where psychology concepts are applied. Again, repeating, give some real life situations where psychology concepts are applied. Okay, somebody wants to speak. Ashwini Verma. Ashwini, you are not clearly audible, dear. Please let me know, is Ashwini clearly audible to you all? Ashwini, are you saying something? We are not audible. Voice echo. Okay. Yes, Ashwini was not audible. It's fine. So my question was that give me some real life examples where you think psychology is applied. Firstly, we discussed some of the branches. Now we are discussing some of the real life situations while drafting curriculum, while designing campaigns, advertisement. Wonderful, wonderful, Rishita, wonderful. Ashwini, my voice is echoing. Can anybody please let me know? Is there any disturbance in my voice? Any kind of echo? Any kind of disturbance? Please let me know. Oh, oh, all right. Now, is it better now? Is it better now? Done, done. All right. Great, great, great. All right. Yes. So give me some real life situations, all my dear students. I'm giving you. All right. For example, she gave me. So we were given, we were given by one of the dearest student. Yes. All right. So moving ahead, this is our class one introduction of counseling and clinical psychology. Give me a very one differentiation between counseling and clinical psychology. Yes, great, great, Charan, great. Dahlia treatment planners, PR marketing, very good, very good. And how can you introduce counseling and clinical psychology? Quickly, we have to brainstorm. अगर सब कुछ मैंने ही आपको पढ़ा दिया then what? पहले मैं आपसे जानूंगी और आपका बोलना बहुत जरूरी है. It is very much needed. तभी तो हमें memory में आएगा. Then only we can recognize ना, because it is the basic step. How memory is a constructive process by repeating it. Once you listen, then you think, then you type, then again I'll read out your messages. ऐसे repetitions होगा. And next time you can watch the recording or you can go through the PDFs and then वो सब आपके mind में store हो जाएगा. Great, 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 Charan, great, Jasmine. See, again coming to the definition part, clinical and counseling psychology are two major fields in psychology. There are so many fields, but these are the basic and major two fields in psychology that focus on understanding, diagnosing, and treating mental health concerns. इसी में से बाकी ब्रांचेस निकल निकल के आई हैं, but these are the major fields, but they differ in their approach and areas of practice. Clinical psychology focuses on the assessment, diagnosis, and treatment of severe mental disorder. Name some severe mental disorders. Charanpreet, counseling also helps in mental problems. Dahlia KP, the same thing happens in counseling also. Great jury. Great, wonderful. So, clinical psychology focuses on the first assessment, the diagnosis and treatment of severe, underline or mark the word severe mental disorders such as schizophrenia, bipolar disorder, major depression. Depression also have anxiety also have different levels. Severe, above average, below average. On the other hand, counseling psychology helps individuals with emotional, social, and life challenges. Now, what are the examples? What can be the examples of these challenges? Multiple personality, Charanpreet, great. Dahlia, ADHD basically is more for special special educators. And चरणप्रीत मल्टीपल पर्सनालिटीज बेटा मल्टीपल पर्सनालिटीज का नेम अभी हो गया है dissociative identity disorder. Can you name some of the challenges that can be dealt by counseling psychologist? For example, I mentioned you some emotional, social, life challenges. Great, wonderful, Anisha. Stress, Savni, overthinking. Great, great. Dissociative, yes, dissociative can be more into clinical one. Some behavioral issues, some emotional challenges, anxiety, stress. Yes. If they are not severe, then it's fine. Okay. So both fields use evidence-based therapy, which we will be learning in upcoming classes, and psychological principles to improve an individual's mental, emotional, and behavioral well-being. Also, counseling psychologists work with self-esteem issues, relationship problems, career guidance. It totally depends on you on which niche you want to work with. If you want to get expertise into one field. So the major difference between clinical and counseling psychology here, what we have understood is that clinical psychology focus on severe mental health disorder, while counseling psychology deals with life transitions and more of emotional well-being. Wonderful, Rishita, Jesslyn, Charanpreet, great, very good. Clinical psychology's approach is to diagnose, assess, and make the treatment plan of mental illness, while the counseling psychology's approach is strength-based, holistic approach. Holistic approach means it might cover so many things, or it might be strength-based. What are the strengths of the individuals that you think? So you have to work on that. But in clinical psychology, the illness have serious level. So we have to assess, complete the assessment part, we have to diagnose it, and then plan treatment. What do you think? Where clinical psychology work and where counseling psychology work? Can you name some of the working settings where clinical and counseling psychologists work? Come on, quickly. Quickly, come on. Clinics, hospitals. Wonderful. Very good. All right. And counseling psychologists work in schools, university, community center, private practices. All right. Wonderful, wonderful. You all are great. Okay. So moving ahead, let's change the slides and come to know. So here are the definitions which we have already discussed. Already discussed. So you will be come to know now. Again, this will be the second rehearsal. Counseling psychology is a branch of psychology that deals with emotional, social, vocational, educational, health related, developmental, and organizational concerns. So wonderful. There are so many things to cover up. Have you ever think of that? Have you ever thought of that? Clinical psychology is a field within psychology that focuses on understanding, diagnosing, treating mental health disorders and emotional or behavioral issues. It integrates psychological science with the practice of clinical care, offering evidence-based therapies to improve individuals' mental health as well as well-being. Can anybody wants to share something? Is there any kind of doubt, any kind of myth, any kind of curiosity is there in your mind? Or we should move ahead? Should we go ahead? Wonderful. So here are the key differences. वो भी हमने थोड़े से डिस्कस करे हैं. The focus area in counseling psychology. Majorly, counseling psychology focuses on enhancing well-being, life transitions, and self-growth. So, what are the points? Like, what do you mean by enhancing well-being, life transitions, self-growth? What comes to your mind when you think of enhancing well-being? Or what are life transitions? What is self-growth? Enhancing well-being can be, just think of real life examples. हो सकता है इसमें हम somatic symptoms ले सकते हैं. Somatic disorder. Can we take the example of somatic disorder? Wonderful. Emotional well-being. Enhancing well-being. Wonderful. What about life transitions? Some examples of major life transitions: job loss, financial crisis, divorce, breakup, loss of spouse, loss of parents, loss of children, COVID, That was that was the transition phase, self growth. It might be that you are not getting promotion and you are feeling that there is something lacking you behind. Then you can go for either therapy, counseling. Still, it is a very big taboo to go for therapies, but there are numbers increasing for therapies, counseling, for third party advice, for third party recommendation. Why so? Because now people are more concerned for their self growth, more concerned for well being. They are living alone, they have very stressful life, they are managing all alone. It might be for studies, it might be for work, and the major focus area for clinical psychologists diagnosing and treating mental disorders, as we have discussed earlier. So, what is the client population in counseling and clinical? Generally, well functioning individuals with mild issues in counseling psychology. Mild issues can be uh, some stress, some anxiety, some issues, daily life issues. And clinical psychology, individuals with severe mental health disorders. What are the approaches used here? In counseling psychology, as we discussed, it is a strength based. So we have to let our client make them aware about their strengths. We use humanistic approach. Are you guys aware about the humanistic approach? What is humanistic approach? Tell me. It was given by Maslow. All right. Hierarchical model, value for human rights, Rochelle's measure. Yes. So, what is the gist of humanistic approach? So, it says that the gist is using a holistic perspective that focus on the whole person and their potential to grow and change. What we what we try to make is make the individual have the capacity to achieve their full potential even in the face of adversity. Yes, yes, Jocelyn. Wonderful, Shamli. And coming to the clinical psychology part, so the approach used in clinical psychology is yes, it uses some activities. So the approach used for clinical psychology is more evidence based. What do you mean by evidence based? जिसके लिए टेस्ट हो चुके हैं, सम अबाउट वैलिडिटी रिलायबिलिटी कहीं तो हमने पढ़ा था, कहीं तो हमें याद है, जिस पे स्टडीज कंडक्ट हो चुकी हैं वो टेस्ट करने. Medical medicines are provided, medicines may be provided here. Diagnostic approaches are done. Hypothesis. Hypothesis is one of the approach, one of the technique, one of the treatment plan. अच्छा, hypothesis, hypnosis, no hypnosis, yeah, hypothetically. Hmm. So settings, what are the working locations here in counseling psychology schools, university, community centers, private practice, and most of the organization. Now, most of the organizations also hiring uh, counseling psychologists, which they term organizational industrial psychologists for the betterment of their employees. And clinical psychologists works in hospitals, mental health clinics. Of course, they also do private practices. So the assessment tools, what do you mean by the assessment tools? What are assessment tools? Test tubes, chemicals. So the assessment tools needed here are the test, inventories, questionnaires, so many synonyms of. If you are a career psychologist, then career assessment. If you want to take any test, then personality test. Interviews. Clinical में क्या हो गया? Psychometric test. And also we need DSM-5. DSM-5 is not limited to psychologists only. If you are doing any research, if you are writing any article, DSM-5. DSM is also known as the Bible of psychology. Are you aware about DSM-5? What do you mean by DSM-5? What is that? ICD-10, DSM-5. What all this have? DSM-5 में क्या है? ICD-10 में क्या है? ऐसा क्या है इनमें? Wonderful. So these all have the proper structure of mental disorders. What are the symptoms? How long duration and much things. For example, suppose if we are having fever, since if we are having fever, तो हम एकदम से डॉक्टर के पास चले जाते हैं? नहीं. We take medicine by ourselves. Paracetamol, crocin. बट अगर 2 days हो जाते हैं, 3 days हो जाते हैं, फीवर नहीं ठीक होता, then we go to doctor. So the first thing doctor asks is कितने दिन हो गए? टेम्परेचर तो है, और क्या फील हो रहा है? Some other symptoms. And if the fever is not prolonged for almost a week, then is this a normal fever? Or we term it as viral? And if fever still persists, then we go for tests. Dengue, malaria, typhoid. Isn't it? Yes or no? So how we come to know कि कौन सा fever है, क्या viral है? These are with symptoms and their time duration, time period. The same way, all the mental health disorders, उनके guidelines, criteria, their time duration, all are mentioned in these books. So the duration of therapy. Coming to the duration of therapy, in counseling psychology, the duration is often short term and solution focused. उस पे हम solution निकालते हैं. If they are having any relationship issue, so couple therapy may be work. रिलेशनशिप इश्यूज सिर्फ स्पाउस में नहीं होते, गर्लफ्रेंड बॉयफ्रेंड में नहीं होते. देयर कैन बी इन मदर डॉटर, फादर सन, मदर इन लॉ डॉटर इन लॉ. So उसका solution निकालना, and it can be short term. It can go for maximum 3 session, maximum 5 session. It totally depends. But in clinical psychology, it can be short or long term. Long term can go up to 4 years also, depending on the severity. Now, coming to the goal part. What is the goal of counseling psychology? Empowering individuals to manage, challenge, and grow. You don't have to make individual habitual of you. The best psychologist or the best counselor is one person who empower their clients so that he or she or they can manage their challenges and grow by themselves. We never advise. We should never advise. We should recommend. We should not use the word advice. We should recommend and empower them. And in clinical psychology, the goal is to reduce symptoms and improve mental health. We have to reduce the symptoms. Is there any doubt till now? Do you have any kind of questions till now? And then we will move ahead. Any kind of doubt? Any kind of question till now? Wonderful. Very nice. Very nice, Beth, I must say. All right. So, coming to another part. Wonderful. Overlaps between counseling and clinical psychology. Now, what does it mean, overlaps? We have learned the difference counseling versus clinical, but there are some overlap also. There are some similarity also in both of them. So, the first aspect is primary goal. These are some shared features in both counseling and psychology. Both aim to improve mental health and enhance clients' overall well-being. Great. Hmm. All right. So before moving ahead, I really want to know that are you clear what you want to be? You want to go for counseling psychology, you want to go for clinical psychology, and I'm sure that you are aware how to be a clinical psychologist, or you need some time to think, still you need some time to think that you want to go with RCI or you want to be a psychologist. Are you sure? Who all wants to go for RCI? I'm giving you 1 minute. Write it down. If you are planning to go for RCA or if you are planning to go for counseling psychologist, write down in the chat box quickly, fast, 1 minute. बीच बीच में ऐसे एक्टिविटीज करते रहना चाहिए वरना बोरिंग हो जाती है क्लास है ना. We have 2 hours. 2 hours is a very long time to stick at one place and study, isn't it? बीच बीच में कुछ ना कुछ ऐसे क्वेश्चंस पूछते रहेंगे ताकि आप बोर भी ना हो, कोई सोए भी ना. एंड आई हैव हर्ड इट सो मेनी टाइम्स ना मैम आपकी आवाज सुन के ना नींद आ जाती है. इज इट ट्रू? इज इट ट्रू? Please let me know. All right. Okay. I'm giving you 1 minute to write it down who all are planning to go for ASEA and who all wants to be counseling psychologist. Of course, Charanpreet, both are possible. If you have done RCI, then you can see clinical psychologists, counseling भी कर सकते हैं. But they have plus point that they can assess also. They can diagnose, they can make the treatment plan, they can deal with major issues also and minor issues also. Of course. So this no ma'am, no ma'am, no ma'am, no ma'am was just for my voice कि मेरी आवाज सुन के आपको नींद नहीं आती. Shamli still assessing both the fields. Okay, preferably clinical. दोनों ठीक है. Wonderful, Anita, Veronica, great, great. All right, ठीक है. So we were on the primary goal. We come to know both aim to improve mental health and enhance clients' overall well-being. All right. So what are the core skills that are needed in counseling and clinical? So the major skills. Skill की तो जरूरत है. If you are, but all are the skills that are needed to become a good counselor, good psychologist, good clinical psychologist, good psychotherapist, good therapist, healer. There are so many terms. Active listening. This is the one thing that is very rare nowadays. Nobody is free to listen you. Once you start saying about your problems, the other people comes with double or triple problems of them. Empathy. Sometimes we show sympathy, but what about empathy? Quickly write it down. What is the difference between sympathy and empathy according to you? Quickly write it down. Rapport building. Secondly, write rapport building. What do you understand by the term rapport building? Great jury, great jury, wonderful. What do you understand by rapport building? Wonderful, Shamli, great, Namrata. Rapport building is a process. Yes, making them comfortable with you by your communication, by showing empathy, by active listening, by good communication. All these things, all the skills come under rapport building. Uh, What are the therapeutic techniques that are needed? What all therapeutic techniques are used in both psychology? Use of evidence-based practices. एविडेंस बेस्ड प्रैक्टिसेस हमने देखा क्लिनिकल साइकोलॉजी में हमें नीडेड होती हैं few tests that all tests are evidence based and some techniques which have evidence that they have given proven results like CBT, mindfulness, solution focused therapies. इन सब का एविडेंस है एंड ये दोनों जगह यूज हो जाती हैं. Assessment part. Both involve psychological testing and evaluation. Examples are given: interviews, standardized tools. Some of the counseling psychologists also can deal with major issues, or they can tie up, they can work with a psychiatrist and counseling psychologist. So the psychiatrist will provide the medicine and counseling will be done by the counseling psychologist. It totally depends how you are working. These things are not limited in words. There are no rules and regulations. Only you have to work ethically under the guidance that are set by the bodies, by the government bodies. You should work ethically, not unethically. Even if you are good at counseling, you can work with major issues also. If you are good at words, if you are good at healing, if you are good at using techniques, mindfulness, relaxation, CBT, solution focus, humanistic approach, person centered theory. Then assessment part, both involve psychological testing. अगर माइनर इश्यूज हैं तभी तो हमें साइकोलॉजिकल टेस्टिंग करना पड़ेगा ना, ये जानने के लिए कि भाई वो बिलो एवरेज है या मेजर है. Again settings, they both can work in private practice, they both can work in schools, hospitals, community centers. काउंसलिंग माइनर इश्यूज के पेशेंट्स तो वहाँ हॉस्पिटल्स में भी आ सकते हैं. हॉस्पिटल्स कैन हायर special educator, clinical psychologist, psychiatrist, and counseling psychologist. Done. Everything will be done under the one roof. What are the ethical standards for both of them? Guided by similar ethical principles, confidentiality, informed consent, and competence. इन सब का क्या मतलब हुआ? Confidential, of course, the details are to be confidential. Why? Because of privacy reasons. And you know what? This confidentiality is not only hiding the documents or the disorder or the problem the client is facing, but also if you are the psychologist of a person, that it is recommended not to approach your client outside your clinic or your working setup until they comes to you. For example, I'm giving you an example that you are a psychologist working in your private setup and you met with a client. Yes, ठीक है, जिसकी आपने कल थेरेपी ली, जिसकी कल आपने काउंसलिंग ली, आज आप दोनों एक पार्टी में मिल गए. There was a quick eye contact and you, being the psychologist, said, "Oh, hi, how are you? So how the work is going on? The techniques or the homework that I gave to you after yesterday's counseling session, did it help you? Is it right that you start the conversation this way?" It is not. Ethically, it is guided that you should not do that. Why so? Because we don't know if the client has come with, there are chances that the client has not disclosed to anybody that he or she is taking therapy sessions. Until unless they approach you and they start the conversation, and it is up to them how they want you to introduce you. All right, and of course confidentiality for so many reasons. कितने सेलिब्रिटीज होते हैं वो प्लास्टिक सर्जरी भी नहीं नहीं डिक्लेयर करते, तो मेंटल therapies are at some other level, and of course we can breach confidentiality. Give me some reasons when can we breach confidentiality. Give me some reasons when we can breach confidentiality. Wonderful, Jocelyn, to do. Clap for you. Yes. For harm to self or others. If somebody is saying that, oh, मुझे दोबारा ऐसा हुआ ना, I'll cut myself, I'll hang myself, I'll jump from my building. अगर आपको लगता है बार बार वो कह रहा है उनकी इंटेंशन ऐसी है या वो कहता है अब अगर उसने मुझे गुस्सा दिखाया ना मैं उसे मार डालूंगा. इसके अलावा yes if the person is in danger. इसके अलावा अगर कोर्ट के ऑर्डर्स आ गए हैं तो if there is some problem, if there is some criminal record या उनके ऊपर one person is going under the counseling session और कोई प्रॉब्लम हो गई थी, he might be in danger, एफआईआर हो गई, कोर्ट के ऑर्डर्स आ गए, तो आपको दिखाना पड़ेगा. एंड देयर आर वेरी लेस चांसेस बट कोई टेररिस्ट को बहुत बड़ा क्रिमिनल आ जाता है एंड ही सेइंग कि आज तो मैं वहां बॉम्ब प्लान कर रहा हूँ, ये कर रहा हूँ, सच भी हो सकता है बट यस देयर आर सम चांसेस टू फॉर ब्रीचिंग कॉन्फिडेंशियलिटी. एंड व्हाट डू यू मीन बाय इन्फॉर्म्ड कंसेंट? What do you mean by informed consent? कंसेंट लेना क्लाइंट से ऑफ कोर्स एक फॉर्म साइन कराते हैं आप तो जिम ज्वाइन करते हैं तो भी आप एक फॉर्म साइन कराते हैं कंसेंट कि ठीक है ना. इन्फॉर्म्ड कंसेंट कैन बी एक तो काउंसलिंग से पहले. इन्फॉर्म्ड कंसेंट हमें तब भी लेना पड़ता है इफ यू आर रिकॉर्डिंग द सेशन. देयर माइट बी चांसेस दैट यू हैव दैट थिंग दैट यू नीड टू रिकॉर्ड द सेशन, तो आपको बताना पड़ेगा. There might be chances that you are having your intern along with you. So you have to take the informed consent from the client. If you're comfortable, my intern will be here. And what do you mean by competence? Ability to perform a task safely. Wonderful, wonderful, Jocelyn. Very good. Yes. The ability to control one's life. How to cope up with the problems. वे से ना हम किसी और को नहीं बदल सकते, हम खुद को बदल सकते हैं. We can't change others. We make changes in ourselves to fit in the environment. Thumbs up. Great. So moving ahead are ethical standards. We learned, oh sorry, ethical standards are done. Now client standard focus, client centered focus. So both prioritize understanding and addressing individual client needs holistically. There are some chances कि हो सकता है client is saying कि मुझे ना बहुत ज़्यादा anxiety रहती है. See, nowadays we all are doctors, we all are lawyers, we all are nutritionists, we all have everything. किसी को कोई problem मुझे take this medicine. किसी को कोई प्रॉब्लम है लीगलिटी से इशू है we just use Google. Everything we है ना. तो क्या है हो सकता है किसी को ये लग रहा है that they are suffering with anxiety. Okay, वो आए but psychologists advise them or recommend them or say that I feel the symptoms are more for depression. Then we have to go for the depression assessment. Or there are chances that the client has come by themselves for the relaxation part or some relaxation therapies. They might come by themselves, but we come to know that the problem is in their relationships. Until and unless their relationship issues get solved, the client cannot get relaxed internally. So we have to provide a holistic approach so that the client can like both priorities, that the client get holistically treatment. और ये दोनों में ही होता है काउंसलिंग में भी क्लिनिकल में भी and multicultural competence. See, culture is everywhere in psychology. We are not going, so we are not doing any kind of discrimination, but culture is there. So both emphasize culture sensitivity and adapting interventions. A holistic approach में ये भी हो सकता है कि सिर्फ हमें एक ही approach नहीं for example, if we are using CBT, तो CBT के साथ साथ we can provide relaxation techniques also. Holistic approach में we can work along with more personalized approach. Overall, client-centered approach. Client को benefit मिलना चाहिए. We can customize the treatment plan or the counseling plan according to them. Is it fine? Anita is waving the hand. Anita, please speak up. Can anybody listen, Anita?
Yeah, hi.
Yeah.
Hi, ma'am. Anita here.
Hello.
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 Yeah, hi. Can you hear me?
Yes, yes.
So, I can't hear your voice.
Am I
Am
audible to you?
yes. You're audible now, but it's breaking a bit. But anyways, for me, you were telling me about combining CBT with relaxation.
For
Uh,
example, if
so,
change your
uh, can you just give a small case study on that? Because like I just want to understand it.
a case study.
Yeah, not like case study. I would say a real life example.
All right, I'm giving you. For example, suppose if a person wants to reduce the weight and he's joining the gym that he'll be doing only the workout,
Mm-hmm.
his strength training, weightlifting, cycling, treadmill. But is it possible? They have to work on diet as well,
Mm-hmm.
finding them.
Mm-hmm.
If suppose a client has come for depression पार्ट और उनका रूटीन सही नहीं है, रात में जागते हैं दिन में सोते हैं, दे स्मोक, दे दे ड्रिंक, सो what we can advise them to quit that और थोड़ा कम करने के लिए टू चेंज द स्लीपिंग पैटर्न। होलिस्टिक में बहुत सारी चीजें डे टू डे लाइफ
Okay.
और वी एडवाइस सीबीटी तो चल ही रहा है बट वी कैन एडवाइस देम टू डू सम फिजिकल एक्टिविटी आल्सो
Okay.
to change them a whole to change
Ma'am, in CBT, what are the things we will be using basically? In CBT, what are the techniques or ways involved in CBT?
in CBT is majorly into the uh, changing the pattern of negative thinking into the positive one
Mm-hmm.
by reframing the negative words into the positive words
Mm-hmm.
and cognitive distortions.
Okay. Is there any technique for that?
Yes, there are so many techniques, positive words, using positive words. Sometimes relaxation also we have to done in CBT. Techniques are like positive words को ही negative words को ही positive में करना. These are the techniques. Cognitive restructuring, word restructuring. This is the technique.
Okay.
We will do in our upcoming class. I'll be
Okay.
preparing uh, activities. I'll be giving you some case studies also. We
Mm-hmm.
will be doing the practical session in our class. We will be doing role plays also.
Okay. 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 Okay,
That
ma'am. Thank you.
practical exposure into that. And of course, coming to the CBT part, CBT is a whole other certification that you have to gain. You have
Yeah.
you have
Okay.
to gain expertise in different techniques so that you can apply.
Exactly. This is what I was very interested to know about the techniques involved. Because we know we have to change the person, by positive into negative. We know what are the faults, what are the negativities, or what are the disadvantages in a person. But I believe in CBT there should be certain ways for different personalities, and for people there should be different ways of handling or correcting them up. So hopefully I believe that I will be learning it in the future sessions.
This what people are doing. Suppose if you have learned a CBT course from
Mhm.
LinkedIn, you will be learning few techniques. If you
Okay.
are doing Yale University, you will be getting some more techniques. But majorly, the whole process or whatever you are curious to know, that comes with practice.
Okay. Okay.
How to deal these personality, how to deal with that personality. Of course, you can learn.
Mm-hmm.
At the time of handling those clients, you can't open up your notes and then work on them.
Exactly.
That comes from within.
Okay, ma'am. Okay, ma'am. Thank you.
Some things are like built in
Mm-hmm.
by default. You have some skills in yourself.
Mm-hmm.
Or you say, go for book reading.
Okay.
So वहाँ से भी we get so much knowledge so that we can work on some topics. And if
Okay.
you are CBT expert and if you are good with the meditation, if you can teach the meditation, if you
Mm-hmm.
are into yoga, or it can be sense that no matter what culture you belong, but if you are into some spiritual practice.
Mm-hmm.
For example, one of the students say that they are tarot readers, Reiki grandmaster. So you can use those techniques also to heal your client.
Okay. Okay.
It totally depends on the client's perspective that they are okay with tarot reading part along with counseling.
Mm-hmm.
Some psychologist or some clinic counselor are more into jams, pearls. They recommend their clients to wear that stone or that gem. for positivity, for different types of reasons.
Okay, ma'am. I got it. Thank you so much.
On your instincts, or see, we say na, so some of the careers, you don't choose those careers, you don't choose those professions. They are in your destiny, or those profession chooses you. I hope it was clear, Anita.
Yeah, yeah, it is absolutely. Thank you so much.
So we were on multicultural competence. So here both emphasis on cultural sensitivity and adapting interventions to diverse populations. So here what is about cultural sensitivity? What is cultural sensitivity? Is anyone aware about the cultural sensitivity? In culture, we are not speaking about the Indian's culture, but everywhere in the world there are different values. They have some different norms, some different beliefs they have. Even like physicians also ask to provide medicines before, are you veg or non-veg? The diets are prepared with their preference, veg or non-veg. We can't force any vegetarian to have non-veg. So their beliefs are to be considered. Yes. So moving ahead, the main part, the roles. What are the roles of counselor and psychologist, clinical psychologist? Okay. So their focus part is, so what is the role of a counselor? They help individuals navigate life challenges. As we mentioned, life challenges या life transitions क्या क्या होते हैं? किसी की जॉब चली गई, suddenly they were sudden spouse loss, or a child was living, or a person was living with their big family for years, and they have shifted to a place alone for work or for study. Some people can't survive, they feel homesick. Personal growth. Okay. And for clinical psychologists, they test individuals with mental health disorders and complex psychological issues. All things are interchangeable, but we have to be clear with the foundations of counseling or clinical psychology for which we are here. Now, the intervention part is, counselors provide talk therapy, emotional support, coping strategies for mild issues, while clinical psychologists use therapeutic interventions. Therapeutic interventions means the therapies which are defined, as we mentioned, CBT, psychodynamic therapy, trauma informed care. There are many other also, but proper therapy sessions go. Assessment part, conduct basic assessments, career test, interviews, and in clinical psychologists, their role is to perform in-depth psychological evaluations where tools are required. Now, again, settings, again, now the scope part. What is the scope for counselor? They can work with individuals facing stress, anxiety. This also we have studied. And clinical psychologists work with severe issues. Now, the training part for counselors are to focus on counseling theories, techniques, and interpersonal skills. Are you aware about interpersonal and intrapersonal skills? Come on. What do you mean by inter and intrapersonal? इंट्रा अपने बारे में इंटर second person interpersonal are used to interact with other and inter so you misunderstood you mistyped intrapersonal and interpersonal के examples Anitha Charanpreet Jasleen and others other 23 candidates students give some real life examples who can be told as interpersonal or interpersonal interest for oneself. Yes, no idea. Jasleen, Charanpreet, define. See, they all have defined, right? So, intra refers to processes happening within a single person when you are aware about yourself. And interpersonal means with between two or more people. So, the real life examples are the psychologist. They can communicate between two or more people. They can make relationships. They can make good interactions. They are the good example of interpersonal. And intra, we say no, good, good spiritual leaders, sadhu babas, Mahatma Buddha, Guru Nanak Dev Ji, इंट्रापर्सनल खुद के बारे में बहुत जानना. Okay, so the training of focus on counseling theories, techniques, and interpersonal skills, and whereas clinical specialized in clinical diagnosis, research and treatment methods. क्योंकि clinical psychologist के पास थोड़े mild major issues के लिए आते हैं, so they are clear with the diagnosis part. They are very well trained, interned with clinical diagnosis research part and their treatment methods. Yes, Charanpreet, that is why they go for that uh, Vipassana meditation campaigns. People are less, but still there are so many gurus. The goal the goal of counselors is to empower clients to improve life satisfaction and well-being, and the goal for clinical psychologists is to reduce psychological symptoms, as we read earlier also. So again, we are here with the key ethical principles. Why? Because it is very important. As we studied earlier, the very important key ethical principles of either of the psychology is confidentiality, informed consent, and competence, which we have studied. Do you want to know more information about all these three things? Should I give you more information related to the same? Yes or no? A bit? I'll be providing you some more information so that we can become more clear, because we have something very special to do in our next slide. See, ethics are essential in either of the psychology, let it be counseling or clinical psychology, to ensure the well being. And of course, trust, safety of clients. And these three ethical principles are very important. So, what is basically confidentiality? It means keeping all client information private and only sharing it when legally or ethically required. All right. If I ask why confidentiality is required, can you answer that? If I ask why confidentiality is important, will you be able to answer that? See, the importance of confidentiality is to build trust between the psychologist and the client. That is why the client will be able to express everything. And of course, confidentiality encourages open communication without fear of judgment. There are so many things that are going on within yourself. Already the world is full of judgments. And of course, confidentiality protects clients' personal information from misuse. We don't know, there are anyone can use anything. And of course, we have discussed the breaching of confidentiality. So, if there is risk of harm, if a client is a danger to themselves or others, it can be suicide, it can be homicide, and in case of child abuse or neglect, You know about POXO? Are you aware about POXO? Let me know. Yes, no, maybe a little bit, something. Wonderful, Jasmine. Yes. According to that law, by the way, POXO, Prevention of Children from Sexual Offences, either if you are doing child abuse or child negligence or sexual assault, or you are the witness, you have the information, but you are not doing, still you will be punished. So, child abuse or child neglect, it can be a person is, suppose you are not doing, but you are the neighbor and you have witnessed something which is very dangerous for a child. Yeah, just let it be. There is a neighbor who is again and again torturing their client. कभी छोटे बच्चे को कभी इस रूम में बंद कर दिया, कभी उस रूम में बंद कर दिया, क्यों? क्योंकि बच्चा खेल रहा था, शोर मचा रहा था, तंग कर रहा था, which is not the right way. और आपको ये देखा, या कभी इतना मारा that the child started bleeding, या उसको कभी कभी bruises होते हैं बॉडी पे, and you have witnessed that. एंड इफ यू आर गोइंग फॉर द ट्रीटमेंट, ये मुझे बहुत ज्यादा फील हुआ, आई डोंट नो, कभी भी किसी को कोई भी चीज बुरी लग जाती है, बहुत ज्यादा इमोशन स्टक हो जाते हैं, ठीक है? सो इन दैट केस यू हैव गॉन टू द साइकोलॉजिस्ट दैट आपको ये सब चीजें नहीं बर्दाश्त हो रही हैं. So in that case, the confidentiality can be breached. That you were coming for counseling to me, and you have seen that that person is harming the child. तो भी, of course, court orders, और कभी-कभी तब भी हम ब्रीच कर सकते हैं कॉन्फिडेंशियलिटी इफ द इन्फॉर्म्ड कंसेंट हैज गिवन द वेवर. मुझे प्रॉब्लम है और मैं कहती हूँ अगर आप मेरी कॉन्फिडेंशियलिटी मेंटेन नहीं करोगे, आप मेरी टेस्टिमनी अपनी वेबसाइट पे दे सकते हो, मेरे एग्जांपल से आप अपनी मार्केटिंग प्रमोशंस कर सकते हो, देन यू आर अलाउड टू गो. ओके, सो दीज आर सम फ्यू other breachment also. Coming to the informed consent part is that it ensures that client fully understand the nature of therapy, how the therapy will go, what will be the objective, what will be the goal, how long will the therapy part go, and what are the chances that your disorder will be cured, or there are chances that your symptoms will be lessened. Any potential risk before treatment begins must be told to the client. Now, it should contain the nature of therapy. The therapy will be talk therapy. The therapy might need some field work, we can say, some outside, which is very rare. But कैसा होगा? What will be the nature of therapy? You should be clear with your qualification. If the person has come to you and is asking for some uh, particular technique, and if you are not qualified for the same, you are not expertise of that thing, you can definitely mention the same. Confidentiality limits should be there, like कब कब आप उनकी प्राइवेसी बाहर शेयर कर सकते हो, कब कब आप उनकी कॉन्फिडेंशियलिटी ब्रेक कर सकते हो, ये सब चीजें क्लाइंट को अगर पहले ही बता दोगे, if you will make your client aware about their rights also, it also comes under the informed consent part. Of course, we should always be clear about the money part. fees, policies, and all. Done? Any doubt till now? Moving on, our third and the last part is competence. So it refers to psychologist ability, training, knowledge to provide effective treatment. अब आपके हाथ में है कि आपने ये वाली ट्रेनिंग ली है, you are knowledgeable enough, and you have experience also to cater. Then go ahead. And why competence matters is because it ensures the quality and ethical therapy. अगर आपने कोई चीज वेल मैनर्ड ट्रेनिंग ली है, then you have the quality to practice that therapy. For example, we can take the example. Uh, Name. Let's take firstly, well, learn why competence is important, because it prevents harm due to lack of expertise. कहते हैं ना, कोविड में डॉक्टर्स बने ना, इंटर्नशिप कर पाए, लाइक यूक्रेन में फाइट हो गई थी तो रशिया के सारे एमबीबीएस स्टूडेंट्स इंडिया आ गए, चाइना से जो कर रहे थे, यूएस से जो कर रहे थे, दे ऑल केम टू इंडिया एंड वर टेकिंग देयर ऑनलाइन क्लासेस, लैब वर्क वाज डन सो लेट. तो ये तो कोविड के डॉक्टर्स है, या कोई यूट्यूब से पढ़ पढ़ के डॉक्टर बन गया. इज इट ओके? नो. व्हाई? Because there is no expertise into them. How will they perform some surgeries? Of course, they have done their internship, everything. But we say ना, तो expertise. अगर आपके पास expertise है, quality है, then it will prevent from harm. And how can psychologists maintain competence? By completing their education, by completing their training, by getting certified into that particular therapy or technique, by ongoing continuing education. क्योंकि थेरेपीज अगर आपने एक कर ली तो आप दूसरी भी सीख सकते हो. You can widen your spectrum. And of course, there is no shame to refer to experts. If a case is beyond your expertise, psychologists refer clients to specialists. अगर आप ऐसा करते हो, इससे आपकी और कॉम्पिटेंस इंक्रीज होती है. Great. Give me a thumbs up who all are done with me. Not me, done till here with me. Who are done till here? Come on, quickly thumbs up. Then we have a the very first activity, not very first activity, the official one, first activity. We'll be starting with it. Come on, quickly give me a thumbs up. Wonderful, wonderful, very great, Anisha and Namrata. All right. So here is our first activity. Group discussion on ethical dilemmas and their resolution. Are you getting something in mind with this activity? I'll explain you in detail. See. So group discussion activity on ethical dilemmas and in counseling and clinical psychology. So what is the objective of this activity? So this activity helps us critically analyze ethical dilemmas in psychology. We can discuss possible solution and apply ethical principles. जो भी हमने ये तीन पढ़े, confidentiality, informed consent and competence in real world scenarios. ठीक है? So what you all have to do now, tell me what is the ethical issue. I'm giving you a case scenario. उसमें से आपने बताना है व्हाट इज द एथिकल इशू, which ethical principle is involved, and give me possible resolution and their consequence. All of you. ठीक है? I'll be repeating again also. Suppose there is a 17-year-old client who has come to you, a 17-year-old minded underage, who has come to you having issues of suicidal thoughts, but begs you not to tell anyone. Oh, what will my parents think of me? He's again and again getting suicidal thoughts, but he's begging you not to tell anyone, fearing what his parents' reaction will be. Are you done till here? Wonderful, wonderful. Did you get the case scenario? Did you get the case scenario? Again repeating, a 17-year-old client confides in you about having suicidal thoughts, but begs you not to tell anyone, fearing their parents' reaction. Wonderful. So you are done with the case scenario, whichever I have discussed. So now answer me in single chat here. First answer, what is the ethical issue? We learned three ethical issues: confidentiality, informed consent, and competence. So name the ethical issue in this scenario. Second, which ethical principles are involved? Which ethical principles are involved? Third, what is the possible resolution and consequence? What is the possible resolution and the consequence? Yes. So you are done with the first answer. Very good. So now give me the second answer. Which ethical principle or principles are involved here? Only first question, not second answer till now. Why so? Why so? Not second answer? Or are you giving only confidentiality for answer for the second one? Why only confidentiality? Why not informed consent? Because client should be aware from the very beginning that confidentiality may be broken in cases of harm. And yes, suicidal thoughts is the case of self-harm. Is the case of self-harm. I hope that I'm clearly audible to you. I hope that I'm clearly audible to you. Am I clearly audible? Then why are you not replying? And what about the third question? Yes, I am audible. So why I'm not getting the answer of second question? That confidentiality is okay, but informed consent is also there because it is the case of self-harm and confidentiality can be broken. And of course, competence can also come there. Why? Because if you are at the early age, early stage of being psychologist, so here this is the case of severity. You might not possess that quality or experience of this crisis of the situation. So competence may also come. Yes, Anita. Anita, by the way, it is very personal choice. If ethically we go, yes, we have to inform the parents of the client or the guardians of the client. But of course, it comes to us with the experience that is this really severe case or the words are just spoken. If they can perform, if they will definitely commit suicide or they are just saying it, it comes with experience. All right. Coming to the third and the last question here is possible resolutions and their consequences. So possible resolutions and their consequences. Please mention possible resolutions and their consequences. Quickly write. See, just brainstorm, just write whatever you come to know about it. We are not judging here, anybody. Anita, if it's serious, then definitely we will recommend it to the expert. See, there can be multiple resolutions, as I mentioned you earlier, और वो हम पे भी depend करता है ना? Sometimes what we do, parents also, what we think as parents of students कि किसी को लगता है कि बच्चा किसी सब्जेक्ट में वीक है, तो क्या सारे ट्यूशंस लगवाते हैं? नहीं, some people think कि अब मदर पढ़ाना शुरू करेगी, पेरेंट्स इन्वॉल्वमेंट इज मस्ट। कई पेरेंट्स क्या सोचते हैं दैट कजन्स अंकल आंटी वो पढ़ाएंगे, ट्यूशंस में तो बस फीस से मतलब होता है, ये पढ़ाएंगे तो अपना समझ के पढ़ाएंगे। बट अदर थिंग दे थिंक कि एक्स्ट्रा क्लासेस के लिए ट्यूशंस लगवा देते हैं, थोड़ा ट्यूशन का हेल्प हो जाएगी तो अच्छे मार्क्स आएंगे। सबकी अपनी अपनी सोच है। सो इज विद द साइकोलॉजिस्ट एज वेल। ठीक है ना? हो सकता है आप इंफॉर्मेशन अभी भी कॉन्फिडेंशियल रखो। So this is one of the resolution by keeping information confidential. So what is the ethical concern here? It is violating. It is violating because it is a case of self-harm. We have to inform the parents, but we are violating ethics. So what will be the possible consequence here? The client may attempt suicide, leading to harm or loss of life. ठीक है? The other possible resolution can be immediately inform parents, guardian without discussing it with the client. So what is the ethical concern here? That it is breaching the client's trust and autonomy. So what will be the possible consequence here? So the possible consequence here will be client may feel betrayed. Why? आपने क्लाइंट से कुछ डिस्कस नहीं करा, बट बाद में आपने उनके पीछे पेरेंट्स गार्जियन से डिस्कस कर दिया। So the possible consequence here, after immediately discussing with parents and guardian, the client may feel betrayed. He might refuse therapy sessions ahead. Okay. There might be some other possible resolution also, that can be you can involve the client to involve trusted adult. आप क्लाइंट को समझा सकते हो कि कोई बात नहीं, देखो आपको प्रॉब्लम है, वी शुड इन्वॉल्व somebody whom you trust so that you cannot harm yourself in future. ठीक है? So what will be the concern here? Ethical concern. It will balance the confidentiality and safety. और क्लाइंट को क्या लगेगा कि वो आपके पीछे से भी क्लाइंट मेरे पेरेंट्स को बता सकता था, बट यहाँ पर आप मेरी इन्वॉल्वमेंट मांग रहे हो, आप मुझसे पूछ रहे हो विच एडल्ट आई ट्रस्ट। अब इसका कॉन्सिक्वेंस क्या होगा? इट विल प्रोटेक्ट द क्लाइंट्स वेल बीइंग while maintaining some trust and autonomy. Is it? All right. So here are Yes, Anita. सी फाइंडिंग द इनर कॉज वो तो हमारा ट्रीटमेंट प्लान चल ही रहा है ना. फाइंडिंग द कॉज, फाइंडिंग द इनर मोस्ट फीलिंग. बट हियर विच वी आर कंसर्न्ड इज द सुसाइडल थॉट, कि हमने वो वाली कॉन्फिडेंशियलिटी ब्रीच कैसे करनी है. अगर सुसाइडल थॉट्स आ रहे हैं तो कोपिंग टेक्निक इतनी जल्दी वर्क नहीं करती. सुसाइडल थॉट से सिवियरिटी का disorder का reason है. Anita, all right. See, if the suicidal thoughts are coming, then coping techniques may take. It is a surety that coping techniques will take time. Suicidal thoughts are the signs of severity. All right. Hmm. So I hope that we are done with this activity. What are the outcomes of this activity? Here, okay? So by the end of this class, along with the activity, what we have done, we are concluding here with our today's class. We have defined counseling and clinical psychology, and we have explained their differences, overlap. We have understood the roles of counseling and clinical psychologists. We learned key ethical principles, confidentiality, informed consent, competence. Along with the activity, we analyzed and resolved clinical dilemmas through group discussion, of course, in the chat way. All right. So we are done with it. I hope you are aware. You found the class good today. I hope you liked today's class. You gained some information. You liked it. So that was it for today. It took more than 2 hours. Okay. So we will see you in your next class. Till the time, keep learning, keep studying, gain more and more knowledge, be curious, find some doubts. Wonderful, wonderful. Okay. So we will see you in next class. You may leave the meeting and you may comment down here. How did you like the class? All right. Good. Thank you so much. So see you in your next class. Bye bye. Take care.